Good morning, friends and seniors and delegates. May I introduce Dr. Vinay Sahasrabudhe, Chief Guest for our session, the Policy Dialogue on Digital Health Governance on stage. May I introduce Dr. Vinod Bhatt, Vice Chancellor, Manipal Academy of Higher Education, on stage. May I introduce Sri Santosh Gupta, CEO, ISRN, on stage. Good morning, delegates. I welcome you all for a policy dialogue on digital health governance, organized by Team ISRN and Prasanna School of Public Health, Manipal Academy of Higher Education. We have on our stage Dr. Vinay Sahasrabudhe, National Vice President BJP, President ICCR, and Member of Parliament Rajya Sabha. We have on our stage Dr. Vinod Bhatt, who is Vice Chancellor of Manipal Academy of Higher Education. We have on our stage Sri Santosh Gupta, who is CEO ISRM, the body behind this policy dialogue. May I invite the delegates for a lamp lighting session. May I invite Dr. Girish Tyagi, DMC Registrar and President-elect Delhi Medical Association, to felicitate our Chief Guest, Dr. Vinay Sahasrabudhe. May I invite Dr. VK Singh, Dr. VK Singh, one of the panelists and moderators, to felicitate Dr. Vinod Bhatt. May I invite Dr. Kamal B. Kapoor to felicitate Sri Santosh Gupta. Dear delegates, this policy dialogue was incepted to address the concern of various stakeholders in the healthcare system and to find a roadmap to deliver healthcare services to the citizen, especially in the rural and inaccessible areas. Digitization holds the key to several of the problem areas around accessibility and awareness. Digitization also holds the key to provide uniform services. As India moves towards digitization, it is time for healthcare sector to pick up the pace with it. In lines with Honorable Prime Minister's emphasis on digital and transparent governance, it is pertinent to adopt digitization in healthcare sector also. But there has to be a uniform framework in sync with the global best practices. Healthcare sector in India is growing at a double-digit growth rate. However, we are net importers of healthcare technology. We import around 70% of healthcare technology, and India is also home to it contributes to more than one third of numbers in people going below poverty line because of catastrophic health expenditures. In the last decade, the number has grown double. The number of households have grown double, and it especially involves a old age population. Also, the policy dialogue cannot be complete without discussions around transparent mechanisms of governance and innovative mechanisms of healthcare financing. There is a $305 billion gap, according to some estimates, to achieve sustainable development goals till 2030. We definitely need better financing mechanisms, innovative financing mechanisms to fund healthcare delivery. Social impact bonds can be one of these. Cooperative models can be one of these. So the policy dialogue is being planned to address three areas: accessibility of healthcare in India, in rural and inaccessible areas, to address the problem of exporting doctors and technology separately. Maybe it's time that we export healthcare technology by combining doctors and engineers together into one bundle. And given our natural prowess in research, education, and training in healthcare, I believe we have a capacity to deliver this mandate. Third issue that we need to address is financing of healthcare and governance models in healthcare. As the society is growing, we need to address the need of citizens. We need to provide them better healthcare, transparent services. Digitization is one of the keys, but not the only key. And four sessions are being planned in this policy dialogue. First session is on country perspectives, where uh, we display the local innovations, the frugal innovations that various countries adopted, including India. And in India, we display a model of Deen Dayal Research Institute, work done by Nanaji Deshmukh in Chitrakoot, and how in frugal little means uh, healthcare system and social improvement was achieved. In after the country perspectives, we have some amazing innovators. We also have innovators from USA and from South Africa in this session, along with the Indian innovators. We also have, after the innovators and best practices, we have session on governance models, where we display cooperative models, data security. We display Indian model of governance and better ways to achieve it through Panchayati Raj. And the last session is on funding. Funding is the most important session that we need to discuss, because it is regarding bridging that $305 billion gap. So we are presenting funding in various heads. There is social impact bonds, there is PPP model, there is cooperative model. I think it will be a good policy dialogue to address all-round issues surrounding healthcare. May I now invite Professor Dr. Vinod Bhatt to give his introductory remark.
Dr. Sahasrabudhe, dignitaries on the days, ladies and gentlemen. This is a very important year for Manipal as we celebrate the 25th year of Manipal Academy of Higher Education becoming to the university. Although we are only a 25-year-old university, the legacy goes a little longer because we set up the medical school back in 1953, so it's 65 years of the medical school, first of its kind in the country, where for the first time private sector entered medical education. And in this year, we thought we should initiate something unique, more to engage with policymakers, more to decide on the future course for the country, and set up a series called Manipal Dialogues. The first of the dialogues was held in Manipal, where we had a talk on India's foreign policy, and the title was India's foreign policy for the 21st century, going from non-alignment to multi-alignment. And this is the second such in the series where we are talking about a whole day discourse which involves multiple stakeholders on digital health governance. We in Manipal have been practitioners of public health rather than policy writers for the country. But there are some good things that we have done which I thought I could share here at this point of time. Way back in 1962-63, we set up something called as Rural Maternity and Child Welfare Homes in a district which was still not developed. And we had covered a large segment of the district population. And sustained efforts in that in the population through those centers, the services continue even today, have made and left behind a telling impact in the community that we serve. When India's infant mortality rate was 400, 100 per thousand live births, the infant death rate in that population that we served was 25. And today, when the infant mortality rate in the country is around 38 per thousand live births, we have reached a figure which is less than 5 per thousand. And this is something that it has happened not overnight, it's not happened because of certain miracles, because it's happened because of hard work, perseverance, and commitment over the last 50 plus years. And this is something that perhaps can, unfortunately, it has not been translated into something larger. It has remained a project. And therefore, I feel there are some good examples like this which you can learn through several agencies, and Manipal is not the only one in this field. Prasanna School of Public Health was set up this year, and in the 25th year of Mahe, and Dr. Helmut Brand is the founder director of the School of Public Health. And what we do are educating, researching, and consulting. The programs that we offer are masters in public health, hospital administration, social work, and statistics with number of other certificates. But also we have specialized centers in community oncology, a center for clinical epidemiology, a public health evidence South Asia, which is based in Manipal, a center for vaccine studies, a Manipal McGill Center for Infectious Disease, and so on, which address different aspects of public health. What else we can do through the School of Public Health is something that perhaps Helmut will elaborate sometime later. But we feel that we can provide evidence through secondary research, which can assist policy decisions. We can take up large-scale projects as we have done through the Center for Virus Research, where we do a surveillance system for the country in acute febrile illnesses, and it's an ICMR influenza reference lab as well. And we can set up a think tank for public policy on health. In today's context, when we are talking about universalization of healthcare, and at a time when we are seeing an emergence of a very strong private sector in healthcare delivery, the emphasis still seems to be on curative services rather than preventive services. And we can see a lopsided allocation of resources for curative rather than preventive services. While Swachh Bharat Abhiyan is laudatory, similar emphasis has to be laid on air and water quality, surveillance for acute illnesses, rapid action against epidemics, pesticide control, antimicrobial stewardship, and other such things. And to do all this, to do a very strong review and monitoring of ongoing health programs, we need a cadre of public health professionals in this country which is absent. There are only a few states in the country which have introduced public health in their healthcare delivery systems. But I feel that if we have to make a significant change and presence in improving the quality of life of our population, we need committed healthcare professionals and especially public health professionals.
Delivers whatever the introductory remarks or the speech over here. But since I am a student of public policy, they suggested that I should be there at least for a while, and which is why I am here. Although I don't consider myself eligible, talking about an issue as intricate as public policy, as healthcare as such. And I'm honest while sharing this with you. But whatever little insight I could gather, I believe any setup for that matter in public health and governance as such at large needs to have the fundamental principle in the modern days, which is professionalism with a human touch. Governance is becoming extremely professional and very required also in a country like India, or for that matter all developing countries. Governance has to be result oriented. And if governance is to be result oriented, it has to be professional. It has to be going by the book. The rules, regulations, and all those things need to be properly in place. And then only you can talk about professionalism, beyond that. But mere professionalism is not enough. It has to be with a human touch. And therefore, while you are into the arenas of socio-economic issues, especially an issue like public health, perhaps equally important is the human touch. Mere professionalism, when we talk about lasting, enduring solutions for healthcare, I think is not enough. And therefore, while digitization is very welcome, and it has its own importance, again, no doubt about it. As a student of public policy, I believe we have to understand the importance, the enormity of digitization, at the same time, the limitations of it. And I'm sure all of us are aware of them. I see a great importance of digitization insofar as spreading awareness about health issues is concerned. More and more people are now switching to smartphones, and therefore information which was considered as not very accessible to them is now accessible with the click of a button on your smartphone. So spreading awareness about healthcare, about health issues through digitization certainly is very, very important. Digitization also helps you make healthcare facilities, healthcare consultations more accessible than they are today, for example. And that is also a given thing. Many people are already using it. So again, on that perhaps there may not be any doubt about. Again, the third dimension of digitization, I believe, is accuracy. Because when it is digitized, it is automatically documented. And when you document certain things, chances are it is more accurate, more correct. While speaking, you are a little liberal, but when you write, when you put it on paper or on your smartphone, chances are that you are more serious and therefore more accurate as well. And therefore, for awareness, for accessibility, and for accuracy, I believe the importance of digitization need not be doubted at all. But digitization of healthcare infrastructure, I believe, should be looked at as a complementary measure to whatever human efforts that we are supposed to put in. Because, as I understand, and today we are talking about artificial intelligence, and it has become very real. I mean, the virtual has become very, very real. And today we have all kinds of gadgets and robots and everything. But somewhere down the line, I believe it is required to be realized, and especially for us, those who are into the eastern part of the world, where societies have different moorings, societies have different value systems. We must understand, I believe, right, that while we can certainly at length talk about artificial intelligence, we cannot talk about artificial emotions. And the day we talk about artificial emotions, I believe there will be a catastrophic change. And that is not something which humanity is looking forward to. And therefore, if emotions cannot be and did not be and should not be artificial, and that too in a scenario where, and you people more know about it than me, that these are the days of not only general diseases coming out of physical disorders, but these are the days of, as what friends like Harsh keep on telling me, psychosomatic disorders. And if the disorders are going to be more psychosomatic, or the reasons for any kind of health-related issue are going to be more about psychosomatic things, then I believe emotions become important. And emotions, perhaps, there are gadgets, I mean, emoticons are there, but to gauge an emotion, which is a real emotion, I believe the virtual world has its own limitations, which we have to bear in mind. And therefore, what I understand is required today is looking into success stories that are available about how digitization is making an impact in healthcare solutions, I mean finding healthcare solutions. There must be some replicable models, if not here, maybe in Africa, maybe in Latin America or elsewhere. And there are people from the Western world who are already practicing it. But as I said, in societies like what we have, where literacy is a problem, technology is a problem, having connectivity is again a problem, all these things having taken into consideration, even then, if there are certain replicable models that have evolved over the period, then I think we need to have better understanding about them, have to gather some deeper insight out of them, and then think of as to how we can make them universally applicable. That I believe is a challenge, and I'm sure this conference would apply its mind to that as well. There are people from other organizations like the Deen Dayal Research Institute here, and several such organizations in India are already deeply engaged into, and for decades together, what I would describe as perhaps folk medicine. And this is something different from what we have as, what we call as quacks. They are not quacks. And therefore, this also requires more documentation and digitization also, so that we don't rubbish a particular system, healthcare system, saying that this is not a modern system. In fact, I keep on debating with people who call allopathy as modern medicine, especially in India, as if all other pathies are unmodern. I don't know why should it be qualified as modern medicine, which is, I believe, very judgmental. And we don't allow Ayurveda and Unani and homeopathy to be modern, because we keep that label only reserved for what is known as allopathy. But that's a different issue altogether. So we need to modernize all our established traditional healthcare systems as well, and pathis as well. For that, whatever research is required, I believe, is certainly very, very important. Another area in which I believe digitization should come as a great help is to seek the feedback of those who are at the receiving end of our healthcare paraphernalia. I mean, I don't understand why students should not be giving suggestions about the kind of textbooks that they require to learn. And this can happen even at class 7 or class 8. And students are smart enough, they can tell us what they would like to learn and what is boring for them. So that feedback is very critical. Similarly, the feedback from patients the feedback coming from the relatives of the patient, because healthcare is not just one-on-one. The entire family is involved when a particular person is not well. And therefore, these things also become very important, because healthcare, as in every other care, I believe, need to be effective, need to be smart, need to be dependable, need to be having a great mutuality of trust, but at the same time need to be appearing like that. And therefore, unless and until the set of persons at the receiving end do consider that digitization is something which is very, very dependable, which is very, very credible, I think we will not be able to take the digitization of healthcare to a different level. Thank you very much.
Sir, rightly put. Doctors and patients, they form the most important stakeholders of healthcare delivery system. And information technology and digitization is a means to connect them, not the solution, not the only part of solution. There has to be a human touch to healthcare delivery. We also need more evidence and evidence-based practices in Ayush systems, and digitization in that aspect is required. There is a given the palpable anxiety between the various stakeholders, I mean the patient groups, the doctors. Public policy in healthcare has to be a continuous process involving consensus building and confidence building of all stakeholders. I'm sure that there are efforts being put into taking consensus from each stakeholders. Uh, as Sir rightly put, the healthcare has to be patient-centered and effective and evidence-based, and there has to be a feedback loop to the delivery of healthcare system. Digitization holds the key to this feedback loop. Digitization holds the key to this accessibility problem and awareness. May I now invite Shri Santosh Gupta, CEO ISRM, for his vote of thanks.
Honorable Member of Parliament, President ICCR, National Vice President BJP, and Vice Chairperson of ISRM, Dr. Vinay Sahasrabudhe, Sri Vinod Bhatt, Vice Chancellor, Manipal Academy of Higher Education, and our most valued invited guests, ladies and gentlemen, and my dear friends. It is my privilege to express vote of thanks on behalf of Indian Social Responsibility Network. I extend deep regards and hearty thanks to our Honorable Chief Guest for sparing his precious time from his busy schedule and to come here. I believe we will get to learn and gain lot of knowledge from your vast experience and insight. Sir, we are greatly encouraged by your precious presence and deeply motivated by your address. I also express my sincere thanks to Vinod Bhatt, Vice Chancellor, Manipal Academy, Higher Education, Professor Helmut Brandt, Professor Engla Brandt, Prasanna School of Public Health, for their presence in the program as well as associated in this program as a program partner. And of course, one of the person who conceptualizing this policy dialogue, Dr. Harsh. So digital health governance is qualitatively different from the traditional health concept and practices. Today is essential to integrate practice for improving life through connected healthcare in the country. Health governance strategy which is essential to their growth and performance, as rightly put up by the both of our speakers. Once again, thank you to our eminent chief guest and guest of the inauguration session. Thank you. I would like to invite you all for tea. And we will back for after 15 minutes for our first technical session. So thank you so much.
Maybe we should go.
Colorful chairs. Yeah.
हॉस्पिटल ट्रीट नहीं करेगा तो रीस्टार्ट करना
Kindly be seated. We are now going to start our keynote lecture on innovations for health. May I also introduce moderator for the program, Dr. Kamal B. Kapoor, who is the founding director of Sharp Sight Center and e-health enthusiast himself, and he will welcome Mr. Robert Maglin for his keynote lecture.
इसे भी ऑन करके चलना है MIC
Very good afternoon. Audible. First of all, before I introduce the preliminary speaker, I have 2 minutes ago I was talking to friends outside. I'm one of the few odd ones out in this meeting. I'm a clinician. I'm a working clinician. In fact, in the morning before I came here, I did my surgery, and then I tried to make here in time. And one reason why I'm here is because apart from my surgeries, my clinical work, digital health fascinates me. IT is my passion. I'm also involved in a lot of projects on imaging systems, interactions, EMR, software development for patient care. So I guess that's one reason I have to be here. So I'll be now inviting Dr. Robert Maglin, who's the chairman of the And I think this session is going to be very, very interesting because we'll be talking country perspective here. And I guess we are at the tipping point or the inflection point in the way health delivery is given, health care is given, health feedback mechanism. As it was said in the previous session, the feedback mechanism in healthcare, I guess, is so very important. It is as or probably more important in the delivery system, in the preventive healthcare or the delivery system. We ourselves have evolved over time in my organization, taking these feedbacks from patients, which are real time. We have these touch mechanisms in my clinic where the patient can give feedback how was the washroom clean today. Did he like the waiting room? If he's a diabetic, was he asked for a tea without sugar? And once we started doing that, one thing it did was it enhanced the patient's experience, patient delight, stickiness of the patient. So when I come here, I come more from the individual point of view, quality care, and most of the people here are scale-oriented, delivery to mass scale healthcare. So I guess it's a very, very interesting working for all of us to have a policy dialogue.
Well, ladies and gentlemen, I share with previous speakers a question whether I am the right person to address, but I'm extremely grateful to both Helmut and Harsh for inviting me. And for me, I see a keynote speech as an opportunity to talk a little bit about everything. And the words in the title of our meeting inspire me personally, not just digital, but health, governance, and most important, I think, the subtitle, Improving Lives. So I take this to be a progressive agenda, and I would say I have come much more to learn than to say what I think. It's what the European Health Commissioner a couple of months ago in Brussels called peer-to-peer learning, an opportunity to extend hands rather than to wave fingers. And it's a shared endeavour, improving lives with shared goals. So, what do we share as seen from Europe? What are we all seeming to see? What are the dead ends we should avoid? And then I will offer 5 thoughts about what could be systemic success factors if we are going to work on digital health in our clinics and countries as well as together. I'd like to start with the shared good news, and it's already been mentioned before. When we face the future on health, we also need to think where we come from. In the last century, globally as well as in India and in Europe, extreme poverty from 85% to 10%. Under 5 mortality from 35% to under 4. And the figures in Manipal show that carefully we can improve on averages also in countries. And the third and fourth examples I want to give are more relevant, I think, to today. Democracy, gently going up from 10% a century ago to 55 today, with that big leap in 1947, which most people don't really notice. This is not a straight line, it went like that. And then vaccination, where until the 60s, there wasn't any. And now we have 85%, and that's about innovation. And I think if we then think, what could we do next? The digital health innovation opportunity is huge, but it's not the only one. Go back to the 60s, 80% of cancers were either without treatment or without cure. And today it's probably down to less than 20. I was talking the other day to a physician investigator in the UK who was saying, my vision is for child rare diseases, where today it's 80% incurable, untreatable, I can get to 20%. And I think the question for today is, if those visions of innovative health improvement are shared, how can digital health improve for us our chances of achieving those goals? Seen from Europe, there are 2 challenges I would emphasize. One is inclusion. So speaking for Europe, we have nice average figures, healthy life years, rising life expectancy. For the poorly educated comparison of everyone in any population across Europe, the difference is a decade. This is an inequity that we struggle to fix. Similarly, in a rich country in Europe, people will say health needs are met 99.5%. You ask poor people, even in a relatively wealthy country such as Italy, the number is almost 20% unmet needs. So we struggle to have inclusion. Sustainability is a challenge wherever you sit. So in India, as we were hearing, how do we fund the finance gap? Europe, it's the same, and the gap is going to grow. Our dependency ratio, old people to young people, will double by 2060. And as a result, 5 to 10% extra points of GDP if we do health in the same way. And we can't afford to do health in the same way, because if we do it the same way, we still have a decade of health inequities for the poorly educated, 15 to 20% excess unmet need for the poor, and unsustainable care models. So we need to see digital health as fixing the inclusion and sustainability problems together. There are 2 dead ends I think we should avoid. I'm not a health professional, so the first is perhaps in the health sphere we say, well, we I don't think it's a public policy person most of my life. Anybody who says we alone will fix it, and they shock. Therefore, I think seeing health broadly and working with more than health people to fix health is crucial. And the second belief I would come with is that what some European journalists call techno-solutionism is not a solution. Technology innovation is part of what we need to do, but as you've already heard from the podium, if it doesn't work for society, it won't work. So then, what 5 success factors do I think might be worth considering? First, as I've already said, is holistic health. The second, as I've already mentioned, is bringing all the actors into our game. The third, if I can say it here in Delhi, is having innovation-friendly India. The fourth is the issue of trust and engagement. And finally, I think here again, this is a well-framed conference, governance and government, how the two work together. So let me very briefly say a few things about each. Already I have said health has to be seen as a broad issue. And I would say the answer to that then is we need top-level ownership of what the World Health Organization talks about as positive health, mental as well as physical. And we need some sort of big performance indicator for our societies owned at the top level, Prime Minister's office, and not just in a small segment. The tragedy is even in Europe, where we can prove that preventive spending carries a 14-to-1 return on investment, where we know that 80% of our health costs are avoidable with good prevention. We still only spend 3% of our budget on prevention. So a holistic health model has to be a public health model. Then it follows, obviously, my second point, you need all the actors in the room. Just one example, in Liverpool, small town in England, 500,000 citizens, Liverpool Health Partnership uses very basic digital technology to enable very local NGOs to feed off the health system in order to better deal with their local needs around multi-morbid, ex-convicts, dealing with drugs, and mental health. A small piece of technology links goodwill in the community, enables it to scale. It's alongside the health system. So everybody is really everybody. But there are two prime actors who too often are regarded as the reserve army of health, who are actually in the vanguard. One is the employer, the owner of the workplace, the manager of the factory. And the second is resources. Now, we sort of think that factories, we have to regulate them. When I say factory, I mean even certain sectors, not only manufacturing. But actually, if we can get inside the minds of managers, show them how good health for their workers is also good health for a company and for a community, this is a big change. And I think, again, see from our posts that the vision is there. That are we helping the people who want to do this to do it right? So I think workplace solution makes a huge difference. We've seen that in Europe, we've seen it in the US, we still don't do enough of it. I think you see it here, the differences between good and bad employment situations. And in schools the same, as Canada has the best data on this, that under five interventions around health literacy, self-efficacy, they pay off. 10-to-1 return on investment. So all actors is not just a nice, everybody come together